Journal. I'm your guest host, Dalila Molina. The Bronx Westchester Area Health Education Center is an organization that works to improve the health of individuals through education. With us now to talk more about AHEC is the Director of Center Programs, Fabricio Caro. Welcome to the show.
Thank you for having me.
Thank you for coming. So, what is AHEC? What is the organization stand for?
Okay, well, AHEC in general is a question that everybody has on their mind. Nationwide, I would say. AHEC stands for Area Health Education Centers, and we've been around since, well, in the New York State area since 1998, but on a national level more since the early 90s. Area Health Education Centers are located within 46 states in the United States, and within New York State, we're located through 9 cities, 6 in upstate rural areas, and 3 here downstate located in the boroughs. As you had mentioned, my name is Bronx Westchester Area Health Education Center. We represent and are located within Bronx and Westchester County. Then there's the Manhattan Staten Island one, which is located out of Manhattan, and then the Brooklyn, Queens, Long Island Area Health Education Center.
Okay, cool. So tell me about the programs that you offer.
Well, the Area Health Education Centers as its entirety nationwide were created as a way to address the issue of the lack of diversity within the healthcare workforce. The type of programs that we have, especially within the Bronx and Westchester Area Health Education Center, are targeted toward improving the numbers or increasing the numbers of underrepresented minorities within the healthcare workforce. So the type of programs that we have target students as early as kindergarten up to the graduate years of college in the forms of mentorships, internships, guided hospital tours, health career awareness workshops, and speaker presentations, which basically expose students to the wide world of health careers. That's on the pipeline end, though. We also do a lot of other things in terms of training the current healthcare workforce and also retaining health professionals to stay in medically underserved areas through incentive-based programs and community health experience programs. Okay,
so how much of that happens here in the Bronx?
Well, within the Bronx, a lot. In terms of we're actually a two-man shop, and it's kind of funny because it's actually my executive director and myself running the show of about like 60 people. What we do here in the Bronx is everything. As I said, we do internships. We've partnered with the New York City Department of Education to be present in various public schools within the Bronx and Westchester County to provide guided hospital tours, speaker presentations, and connecting students for mentorship and internship programs within community health centers and hospitals.
Okay. So where in the Bronx are you located?
We're actually located out of Lehman College in Carmen Hall, room 241, for those to be exact. But we actually had several satellite sites that were actually, due to funding, broken down and centralized into Lehman College.
Okay. So what are some of the facilities that you work with?
We work with various academic institutions, community health centers, and hospitals. Just to name a few within the Bronx, we work with Albert Einstein College of Medicine, Montefiore System, which is part of the Albert Einstein College of Medicine, Bronx Lebanon, Lincoln Hospital, AHEC, or the Hospitals Association of New York City, St. Barnabas Hospital. Within Westchester County, we work with the Westchester Department of Health, and due to the fact that we receive New York State Department of Health funding, we work with the Department of Health in New York State as its entirety as well.
Oh, okay. So how old or what grade or college level do these students have to be to participate in that?
Well, as I said, they do start as early as kindergarten, but primarily the target group that we provide programs for, based on research alone, that they take more out of it, is been as early as middle school, from 6 all the way to senior year of college. We also do graduate programs in terms of students that are in their medical school, in terms of providing community health experience, but the main target area is middle school all the way to the undergraduate years of college.
Okay, wow. So what exactly do they do in these programs?
Well, more along the middle school side, we do guided hospital tours, or what we call a health career awareness, health career scholars, not health career awareness, but health career scholars program. What we do is build a curriculum specifically toward the targeted school and basically address several issues in terms of health career awareness, health disparity awareness, and and basically job development skills for students as early as middle school, and then top it off with guided hospital tour, in which students are basically immersed into the healthcare setting with wearing like scrubs or medical jackets, and they take a full-length tour in and out of a community health center or hospital.
Wow.
Then, or in the high school end, we do internship programs and mentorship programs in which students actually build on career skills and actually work within a hospital throughout the summer, throughout the academic year, and intern behind the scenes, I would say, at these centers as well.
Wow. So how do they react in this program?
Well, on a lot of different ends. I mean, technically, as I said, our mission is to increase underrepresented minorities in the healthcare workforce. So technically, students react as, I couldn't imagine, you know, that I could see myself in a healthcare setting. Yeah. I thought, you know, basically our programs are targeted to demystify that notion that minorities aren't present in the healthcare workforce.
Right.
So.
Wow. So are some of them scared by blood and, you know, sick people?
Well, technically they are, but we promote the whole world the wide world of health careers, I would say. Not only on the clinical side and the direct patient care side, but also on the administrative end and on like the behind the scenes work in terms of health information technology, or, you know, the social work or case management end.
All right, so tell us a little bit about your summer health internship program.
Well, that is one of our hallmark high school programs and also undergraduate and college programs. It's been running for a total of 5 years right now. Successfully, we've graduated a total of 40 students per summer. And what it is a 6-week internship program which we connect students that live or reside in the Bronx, or that live or attend in schools in the Bronx or Westchester counties, and we connect them to their interest in a health career with a local hospital or community health center, in which they shadow for 6 weeks a health profession in that career. 3 days out of the week they're working at the center or the site, and once a week they report back to Lehman College, in which they are provided didactic sessions which cover health career awareness, college admissions guidance, financial aid guidance, and job and career development workshops.